All right, welcome everyone. My name is Charles Vilmren, and I'm excited to, why am I excited? So many reasons. One, the topic of our webinar. Two, our amazing speakers that I'm going to introduce in a few minutes, Rachelle Blough and Dr. Jennifer Stelter. By the way, thank you so much for being with us. Excited to have you and have this amazing conversation about um, how we start to navigate this guide model from CMS. It's probably one of the most exciting things happening in memory care right now. And probably like many of you, I'm excited to hear from our great speakers. Before we start, just a few announcements is that we have different sets of CEUs that are available: NAB, NCAP, NCTRC, and NCCDP. That are approved. And to get these CEUs, we need to fill in the survey that you will find in the chat at the end, or will be sent by email. And you need to do that by Friday, this Friday, coming Friday. And then we'll be sending CEU certificates next week. So a little bit of background. Activity Strong was started by Link Senior in partnership with Activity Connection, NAP, and NCAP. And the whole idea is to help acknowledge the amazing work of activities and life enrichment professionals, educate them, and empower them with tools. One of the very exciting announcements that came out a little more than a month ago is that LifeLoop acquired Link Senior. So we're now all under LifeLoop. And so my position is general manager of Link Senior within LifeLoop. And there are many reasons why I'm so excited about this, but I would say that at the high level, it's really this idea of aligned mission over how we improve lives of our residents in senior living, and especially people living with dementia. If you have any questions about this, obviously look us up online or contact us. More than happy to have conversations. Just a little bit of background on Link Senior per se, and actually that's started by myself. But Link Senior per se, we had two initiatives that we are very excited to carry on. One of them obviously is Activity Strong, and then the other one is Old People That Cool. And I see that our chat is being really busy. Just as a quick reminder, when you chat, make sure you select everyone, because by default, sometimes it's on host and panelist, and we want to make sure that everyone sees your contributions. Link Senior itself was a company that touched the lives of 50,000 residents. We worked with amazing organizations, and we're very happy and excited to carry that work within LifeLoop. We worked with organizations. We now continue to work with organizations ranging from life plan communities, senior living communities, and skilled nursing providers as well. And the whole idea is to help team members do what they love, which is to bring purpose to residents, right? We all make this promise of person-directed living, and often the more we empower activity professionals, the better quality of life, happiness of residents, outcomes, occupancy, and so on and so on. So we've always been focused on that, and very proud to also have a research study done and published in a very good publication called the Senior Housing and Care Journal back in 2019. So that's a little bit about the background on the organizations with an S. And now on to our topic. So obviously there's many reasons to get excited about the guide model. I would say that at the high level, the objectives that we have, given the fact that it's a rather new, we're going to start from the beginning, and obviously great experts to share knowledge on this. But what is the guide model? How it impacts residents and the caregiver role? And then we're going to discuss the role of family and the dynamic with the different actors. As a quick introduction of why the topic matters, I would say that at the high level, most of us, if not all of us on this audience, we are 100% passionate about older adults and sometimes even people living with dementia. But sometimes something that we forget is to make that person successful as much as possible. We sometimes tend to forget the support circle, which is the caregiver. And often if that caregiver is at home or in different types of setting, there's been a lack of tools and models to make that person successful in that caregiving model. So at a high level, this is one of the many reasons why we selected this topic today. And I probably need to stop talking too much because we have amazing experts, way better than I am, to talk about this thing. So I'm excited to introduce you all to Dr. Jennifer Stelter, who is obviously very attuned to activity strong. Thank you so much, Jennifer Stelter, for coming back. And then Rachelle Blough, who is the owner of Rachelle Blough Ltd. Limited. And I will stop sharing here and I'll let you both take it away from here. Thank you so much for being with us.
Thank you so much, Charles. We really appreciate allowing us to come on today and share about this very important initiative, brought on by CMS. But before I hop into that, I just wanted to kind of remind people, or maybe you haven't heard of, the Resident Engagement Institute. And so I'm very grateful to have Rachelle Blough on today. She's one of the faculty on the Institute team. I am the Chief Engagement Officer for the team itself. This was an initiative actually developed by Charles and kind of edited with myself a couple of years ago during the pandemic, actually, and really with a way to raise the level of engagement that we provide people in senior living. And so we've intermittently talked about it at different webinars and things like that, but we're excited to continue the efforts here under the Life Loop brand as well. And so with the Resident Engagement Institute, our vision has not changed. We want to ensure that we are trying to make social prescription the standard in senior living. That's really about prescribing engagement and changing the way that we look at individuals and really trying to engage them through their social determinants of care. And so actually 70% of our health is made up of our social determinants of care, if you can believe that. And so we want to make sure that people are moving more towards enabling engagement via different kinds of social standards, via non-pharmacological tools, using different kinds of holistic kinds of tools, right? And with a less need for medication. So that's really kind of our vision here for the Resident Engagement Institute. Our mission really is to engage folks like yourself, senior living activity professionals, life enrichment professionals, senior living operators, and providing folks education, tools, and support at really elevating that care. And so our objective really is, we have from day one been really research-based. So we want to make sure that the information, tools, the data that we publish is all based on research. And we want to be able to do that to make sure that what we're continuing to put out in the market is measurable. It is replicable, meaning that people can reuse this over and over again, right? And we keep data on it to make sure that we're getting some good clinical outcomes. So stay tuned. If you get an opportunity to visit us, one thing I want to note too is that the Institute is available to all of our Link Senior / Life Loop customers. So that's exciting. Here's the faculty. A lot of these folks do not need any introduction. We are so excited to continue to have the support internationally from these renowned thought leaders in this industry. From Cameron Camp's Montessori method to David Trexler's Best Friends approach, right? Rachelle, myself, and a lot of other folks that have done amazing work in this industry. I'm excited for what the future holds, in working with Life Loop as well. So with that said, please check out our website, rei.linksenior.com. We'll let you know if that changes over to a Life Loop URL per se, but we're really excited to be able to continue to bring this to you. So hopefully you'll check us out. Okay, let's get into why you're here. So as Charles mentioned, we've got 3 objectives we're going to cover. One, we're going to learn about what is the guide model and its components. And I think that I just want to say we're all still learning about what this guide program is. 2, we're going to understand how this impacts your residents, your role, caregivers' roles, and then talk a little bit about family. We've got an amazing guest on today, Barbara, who is not only a family member who took care of her mother who had advancing Alzheimer's disease, but she also has dedicated her life in the senior living industry as well because of her work. And so we're going to hear from her and her journey as well, and her thoughts on the guide program. So let's dive into what is the guide program. So the objective of the guide program is to support individuals who are living at home with dementia. Now you see an asterisk for home, right? Let's define what home is. So home can refer to people living in the community, at their residence. It could be folks who are living in independent living, and also those in assisted living facilities, okay? There's 3 goals under this objectives. They really want to standardize the best practices in our industry and be able to provide those to residents living with dementia, who are, I want to be specific, Medicare beneficiaries, okay? And this is really to support their unpaid caregivers as well. And this is really going to be provided using an interdisciplinary approach. And I think that this is one of the key areas that a lot of families don't have the support of, is having this interdisciplinary approach, right? Oftentimes families are told, or the loved one is told, that they have a diagnosis and they kind of have to figure it out themselves. And it's been that way for decades. But to be able to be handed per se a team that's going to work with you and your loved one is unbelievable. So we'll get more into that. And then the third goal, of course, is to support those individuals with dementia, really to remain at home longer. That's the overall goal. We know that's not always the journey, but the goal is to do that. And whatever that home may be, again, is defined in different ways. It's also meant to, of course, improve quality of life. So there'll be clinical measures that are being kept along the way, reduce burden on those caregivers, as well as to minimize any long-term nursing home placement, okay? Let me go ahead and actually go to the slideshow part here so you can see it better. All right, who is eligible? Okay, so folks who are eligible are anyone who has a diagnosis of any form of dementia. So it's not specific to Alzheimer's disease, it's any form of dementia. This does have to be documented by an MD or a PhD/PsyD, which is usually a neuro or clinical psychologist in the industry. And this person who is providing this evaluation is a Medicare enrolled practitioner, okay? The individual has to have traditional Medicare benefits as well. So this does not include folks who have Medicare Advantage plans, who are on Medicaid or other insurances, okay? It's folks living in the community, in ILs, in ALs. It is not for those who are in nursing homes, okay? And it's also for those who are not currently enrolled in the Medicare hospice benefit, okay? Now, if for some reason they're paying for hospice privately, they could potentially still enroll in this program, okay? So I hope that kind of clears things up as to who is eligible. So let's talk about the person with dementia. They're considered the beneficiary, right, of Medicare. How do they benefit? So there's no out-of-pocket expenses to them. So no copays, no deductibles, nothing like that to meet, which is great. They will receive 24/7 access to trained physicians and nurse practitioners. I mean, this is unbelievable, right? Rachelle and I were talking about this yesterday. And Rachelle, I'm going to have you unmute. I want you to talk a little about your experience, because when you learned about this aspect of the guide model, you were like, this would have been a game changer, because you also, have been in this industry for a long time. You cared for your mother as well, who had a lot of medical conditions and things like that. So when you heard that, what was that like for you?
I mean, it almost feels too good to be true, but when you think about, like, you finally crack or unlayer the onion to some aha, it takes so many families in the crisis and the overwhelm. They may never get to this. And Jennifer, I know you and I both kind of have a lot of the same philosophy with prevention versus intervention. This is like that on steroids, that imagine these people in the earlier part of their journey getting somebody for free 24 hours, 7 days a week. I know it just feels too good to be true, but I think it has so much potential, with this prevention, instead of waiting till there's the crisis.
Right. And we had talked about too, this is an assumption, but, because you're talking to trained physicians and nurse practitioners, you are enrolled as a beneficiary to the guide model, that they'll have access to your medical record, right? I mean, there are a lot of helpful resources out there, but I don't think you can replace being able to have that person who's helping you have direct access to your information that can help guide you through a crisis or a situation or questions you might have around maybe mom's medications, things like that. And to be able to have that access where the person can just boop, 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 look you up and there you go. I mean, that's amazing. So yeah, a game
I think it's
changer.
gonna help too, where people may not be over medicated or too many of the same things. I think you and I gave the analogy, while we adore the Alzheimer's Association helpline, you're spending half the time just trying to get them up to speed on your own, what you're dealing with. Whereas all these different disciplines can just pull it up and see what each other did.
Exactly. There's finally communication, right? So we'll get to that in a moment. But yeah, you're talking about med reconciliation. This is offered as well to hopefully really reduce those high-risk medications. We see people living with dementia way over medicated on complicated psychotropic medications that are unfortunately causing side effects that maybe they're on other medications to resolve. We call that the prescribing cascade. It's a nightmare. Hopefully this reduces that as well. And then also looking at, we go back to, of course, the REI's mission, which is to look at social prescribing. And this guide model is going to support that by looking at and screening for their social needs and providing access to them and their family with social resources in the community, which is unbelievable. And then kind of, we just touched upon this, but more importantly, I think to be able to be kind of awarded or given this multidisciplinary team that's going to consist of the specialties or the specialists that you need in this journey. I mean, this is a godsend because it really is going to benefit the navigation of this whole journey. And to have these team members talking to each other and being able to see who else is doing what. Right. Again, to your point, Rachelle, it's going to reduce psychotropics, or any kind of over medication in that realm. It's going to streamline services. It's going to be able to start services sooner so that, without the family member having to figure out where to find these people and what their phone numbers are and is it covered and all of this stuff, right? Just to be able to be given this is really a gift in and of itself. So those are some of the benefits for the beneficiary. How about for you as the community? For those who are listening in, maybe you work in a community, maybe you're part of a larger organization, maybe you're in operations. How is it going to benefit you? So this is where I'm going to take a little bit of time to kind of slow down and talk about some of the intricacies of this so we can kind of understand this better. So there are participants or participant teams that have been approved by CMS so far. These are teams that are usually that work in the community. It consists of, for your physicians, your neurologists, your therapists, so physical occupational speech, psychologists, whether neuroclinical, it could potentially be nutritionists, right? And so on and so forth, right? The people that we typically try to partner our residents with, in our communities and maybe out, in the community itself, we try to partner them with. These are the teams that are formulated together. These are teams that have decided to come together and work together. Instead of working in silos, they're working together and have applied together to the guide model to be able to be approved by CMS. So they've actually come out with their first approved list. So I'm going to share that with you a little later. But that's something where they are now considered the participant teams, and they're spread throughout the United States. These participant teams are provided a pre-beneficiary payment per month per resident. Okay, so when they take in that client, patient, resident, whatever they may call their customers, they're going to receive a monthly benefit for that. Okay, and that's paid by Medicare. Now, what's going to happen is that if for communities, you can become a partner with this participant team. So for example, if you want to provide respite services, if you are a home care company providing home care services, right? You will become a partner with these participants. And we'll talk about how do you do that later in case you're interested in something like that. You unfortunately cannot become a participant yourself, okay? This is, again, a community conglomerate out in the community, but you can become a partner. Now, what happens is there's a contractual agreement between the participant team and the partners as to the allocated dollars that come from Medicare for that per beneficiary payment per resident per month. Okay, so I hope that kind of makes sense. As a community, as I mentioned, you can offer respite services. And so they're paying up to $2,500 a month per year. I'm sorry, not per month, per year for that resident to be able to take advantage of these services. Okay, so you would be able to take advantage of that if you became a partner with a participant team. What's also great is as a partner, you actually will have access to other clinical resources that can come on to your existing team, kind of help support what you already have, which is great in times when we have staffing challenges. You will also be provided ongoing clinical outcome reports of the residents that are enrolled in this program. So this is great because you can use this for competitor analysis differentiators, marketing, if you're negotiating value-based contracts, this data is going to help you, and you don't have to do it yourself. This will be given to you by that participant team. Also, it's going to increase your credibility. To be able to be partnered with such a massive movement in our industry is great. And then it's also going to increase your visibility, right? Because you will be kind of listed as partners of this participant team and shown that you're kind of in the game, if you will. And that can lead to increased occupancy. Also, what's nice is if you decide to offer these respite services, as we know, if you've ever offered these before, sometimes these do transition into move-ins. So they come, they try it out, they may like it, or the family may realize this is better because they're getting better quality care, more attention, more socialization, and there's an agreement that the individual will stay. So this actually can help increase occupancy that way too. And what's also great is the participant team is required to provide ongoing education and guidance to your dementia care team. So, the dementia requirements for education per year that is part of, whether it's an AL or another, entity, they can help and supplement that education that's required. Now, some of this does kind of transition over to the unpaid caregiver, because they would be, I'm going to kind of go back here for a moment. When I bolded in home, right, there could be they can be part of this partnership, right, where maybe they don't have home caregivers coming in to take care of their loved ones, and they're the main caregiver. So they become part of that respite benefit, if you will. So let me explain that here in a second. But as I mentioned, the unpaid caregiver can become that partner as the in-home caregiver if they are not using home care services. So let's move on to the unpaid caregiver benefit. So what does the definition of caregiver mean? Okay, so here I give you the exact definition by CMS, defined as a relative or unpaid non-relative, that would be either a home care service or a caregiver of some other sort, who assists the beneficiary with activities of daily living, so ADLs, and or instrumental activities of daily living, okay, so IADLs. Depending on the beneficiary's need, the assistance may be episodic, daily, or occasional, okay? And this would actually be driven by an assessment by the participant team to be able to determine how many hours are needed. And of course, it's in negotiation with the family and things like that. So as mentioned, we want to look at what are those benefits. So it really aims to address the burden on the unpaid caregivers, where they have access again to dementia education and training. They have access to this 24/7 support service. And then of course, a connection to the community-based providers, this participant team, where it's, they're being kind of guided through this journey in a more structured, standardized way, right? If you follow any of my kind of posts or blogs that I have on the Dementia Connection Institute.org website, is I talk a lot about the fact that, and I'm just so frustrated sometimes, I love physicians, but so many times families come to me and they say, okay, mom was diagnosed and my physician told me there's nothing we can do. And I always say, yes, there is no cure. And maybe they need to articulate that a little bit better. But what they should say is, there is no cure, but there are lots of things that can be done, right? And hopefully now with the guide model, the physician can guide them to a guide participant team that can really help guide them through this journey, right? I'm kind of overusing the word guide, but that's the case here. Hopefully we don't have those statements anymore of there's nothing more we can do. Hopefully that fades away in the background and families have all the support services that they need. I really do hope that that's the case. As mentioned, families can take advantage of this respite program, so they can decide that they want to temporarily move mom into an assisted living community. or have home care services temporarily if they're going out of town, something like that, or they just need a break. Now that all comes from one pool per year. It's that $2,500 benefit per year. So whether they are arranging to get paid themselves out of that per year, or they're using a portion of it for respite services, right? And that's all an agreement that goes along with that participant team that the family and resident is assigned to, okay? So this is kind of the first time ever that family caregivers can get paid to take care of their loved ones, right? Now, we do realize that sometimes that can be limited. So they may work part-time and then be able to caregive part-time. Sometimes they may decide to give up their career and be a full-time caregiver. That's okay too. But in the event that maybe they aren't able to not work full-time, so they have to work full-time, they need that in-home caregiver to come in, there is that benefit that can help pay for it. So no longer having to necessarily pay out of pocket for home care services, which can be very costly, okay? Now, I know sometimes families look at the $2,500 and they're saying, that's not a lot of money. It's not a lot of money, let's be honest. So let's just see how, the chips fall. Potentially there could be, with data collection, they can maybe see that this benefit for $2,500 maybe is running out quickly and families need more. Maybe they'll increase that benefit through data collection. We'll kind of have to see how that plays out. Rachelle, what do you think about that with that $2,500 per year?
Oh, well, the chat was blowing up about how unbelievably low it is.
Yeah.
And I've been over here last night and today doing math. If I could go back and would have had this resource, it looks like every other week, the average cost for a private duty is $28. You could have about 3.5 hours of respite every other week. So you could have got out and worked out and saw a friend and tried to, manage your own stress. But again, it's not a lot. The other thing I think there's an opportunity is for, and we're not giving business advice, of course, but I know some of the assisted livings I worked in, we had a day respite program where people, as long as they had a place they could lay down and so forth, I understand on average it's about $100 a day, but a person could go to a half day of respite at an assisted living for $50 a day, almost, weekly. And we know how much socialization can make the difference. That could be a first chance for people to experience your community. And to me, that would be another nice way, is like a half day at an adult day, almost weekly, to give that family a break to run their own errands and regroup. And so I was playing with the number. How do you maximize that low amount?
Yes. So it looks, yeah. So we have to start somewhere, right? So I think, hopefully that we can, boost that up as the progression goes on with the pilot program, right? The program is set for 8 years, and they'll be collecting data along the way. Who knows, maybe they may make adjustments as the years go on, as data comes out to see how successful this is, but I think we're all in agreement that $2,500 is not a lot of money when it comes to all the things that you can potentially use. So I think we're in agreement with the audience here that's making all those comments as well. So in terms of, how do you gain access to this? Because that's been the kind of question. How do I get involved, right? So if you are an individual who is looking to understand, how to schedule an appointment and who's already approved as participant teams, I'm going to put a link in the chat box for you. Now, this is a CSV file, so it's an Excel file. It's not a website. So when you click on it, it's going to go to your downloads and you download it and it comes out as an Excel. Okay. So I'm going to put that in the chat box so you can take advantage of that and take a look at who are all initially approved throughout the United States. There's quite a number of them. They don't list phone numbers, so you're going to have to kind of Google the name, and they do give the address, so you're kind of pointing to the right person, but you can gain access to the phone numbers that way and call. And I want Rachelle to she did a little kind of investigative work for us this week about, I want to call one of these and just see how, if I were a family member, what can they tell me? Do they know about the guide model, right? So Rachelle, tell us about that while I put this link in the chat box.
Well, I wanted to be ethical, but I felt a little bit like a secret shopper. And I said, I just really wanted to understand this. I work in the industry and I want to, I bet a lot of you we become like my brother's sister's boyfriend's mom has been confused lately. Do you have any thoughts? Because they know we work in the industry and we just are helpers. So I did reach out to one of the listed established programs on the list you'll receive in Illinois, because we're in Chicago. And the lady was delightful. She was an enrollment coordinator, immediately could give me a specific phone number to call. The assessment could be done within a week. That was one of my concerns, Jennifer, was like, is there going to be a backup of months to get in this? Because it's so good to be true. But as of right now, probably because it's a little underground resource, they said they glean and determine within a few days to be sure it's Medicare B, so that they are going to determine that person's eligible. And then within 7 days, they're getting some appointment. And then they get that 24-hour care navigator that they can contact. So they knew what they were talking about. They had flyers. They were ready. I just kept saying to her, this is just so exciting. It feels too good to be true. She said, yeah, there's a lot of good energy out there. And so I hope that's true for any of you who might contact someone on your own state, because we all know it could get lost in the shuffle at the front desk. But
yeah, I mean, it's just so reassuring when you told me that it was an easy process just to navigate in the beginning stages, because that can really deter families, right? If they're calling and then people don't know what they're talking about, or like you said, oh, we can get you in the next 6 months. It's like, oh, here we go, another system I have to navigate, right? So that was really reassuring when you told us that, and I just want to kind of throw it out there too. Is there anybody that's on the call that is currently enrolled as a partner with a participant team? Share your experience in the chat box, please, because I think that would be really helpful to kind of understand if there's folks currently who are participating in this, which is exciting. And for communities, again, take a look at the list that I sent. If you're looking to become a partner, look up, one that's near you and see if you can sustain or, be able to reach out to get a meeting with the person in charge there to see, hey, we want to be a partner with you. I'm sure every participant team is kind of doing it differently. There is a contract that's involved, so I'm just kind of being upfront with that. That's a requirement by CMS of how many dollars go to the partners of the participant dollars that are given to them. So, with that said, you can kind of look to see if you can partner and how to get involved. So, but I'm gonna, I just want to kind of briefly show you this navigation process. I apologize for the small writing here. This is actually on the CMS website. I did share a link with you to provide, give more information. But this is just an example. Margaret's been diagnosed with dementia. Her daughter Kathy's the caregiver. Margaret and Kathy are concerned about Margaret's future and being able to meet her evolving needs at home. So what we're typically used to is this kind of common dementia care experience where Margaret and Kathy feel like they're uncertain. Where are these resources? What do I do? They may have been told by their doctor of, search on the internet, find some information, or here's a pamphlet, and call me in 6 months, those kinds of things, right? Then, Margaret's, having issues with medication management at home. Kathy's struggling with the day-to-day responsibility of taking care of mom and also, working full time. Then, Kathy becomes stressed, isn't quite sure, what to do. Margaret becomes, more symptomatic, whether that's, she becomes more aggressive, or maybe she's sundowning more, right? Potentially then there's falls, right? Then, of course, they contact their doctor, more medication might be added. And really just, they're both feeling kind of lost in this journey. So the experience under guide is that there is a comprehensive assessment that is done after that appointment is made. As Rachelle said, some places you get in within a week, which is unbelievable. The diagnosis is confirmed that they do have some form of dementia. They're provided a care navigator who will help them navigate these recommended services. They're provided that treatment team, along with that, very specific person-centered care plan of really how to navigate the journey. Then they're enrolled in training services. They are provided this dementia education, that 24/7 hotline. And then from there, they kind of progress, and they're continuously meeting with the team and making sure that the care plan is followed through with, and that, of course, more importantly, Margaret is benefiting and Kathy has this ease of use of navigation. So that's really kind of where we see just insurmountable change in our industry. And I'm looking forward to see what it will become. You know, we do hope that it will be what they're saying it's going to be. But I'm going to stop sharing my slides right now because we want to hear from a caregiver herself who navigated through a long journey of Alzheimer's disease with her mom. Barb is here with us. We want to hear more from her about what she thinks about this, but you know, first we want to hear about her journey. So Rachelle and Barb.
Appreciate it. Well, Barb, it's so kind of you to, you know, sometimes I know this stirs up emotion and going back to a time, but you and I've had a few good talks over coffee and learning about what you went through. And I know we're both Ohio girls. We went to the same college, and just, you know, I think kind of are the sandwich generation in some ways, supporting our parents, you know, supporting children. And so if you wouldn't mind sharing, you know, what was it like for you to have to navigate that as a daughter? I know you were in the Cleveland, Ohio area when you first found out the information. Did you have support, or was it just kind of, here's a diagnosis, good luck? Tell us a little bit about how that was for you.
Hi, yeah, sure. Thanks for having me.
Thank you.
You know, my mom was diagnosed probably at like age 69. And you know, I think for the average just person has never been in this Alzheimer's world, it's like you think dementia, you hear the word and you think, oh, they just forgot their keys, you know, and that's what people think. It's just a memory thing and they forgot a few things, and you just have no idea the like the scope and the range of symptoms that are about to happen. I mean, you go from like, oh, my mom forgot something to, you know, quickly down the road, you know, she's having a tea party with fake people in the other room. And you're like, whoa, what just happened here? You know, or, you know, she looks in the mirror and doesn't recognize who she is. And I think that was the biggest shock for me, is that nobody really gives you a lot of forewarning about the extreme symptoms that happen. I mean, there's just no playbook. And that was when I first read this question, kind of like how it felt. I would say frustration and fear, because just people don't tell you. You know, it's like, you know, the doctor, you walk into a renowned Alzheimer's doctor and you're like, you know, just as you said earlier, Jennifer, you're just kind of like, okay, you have Alzheimer's, bye, you know. And I remember walking out of the hospital like crying, because I was like, what do you mean? Like, that's it?
Yeah.
So, you know, that is in a nutshell kind of like the beginning of the journey. And you know, and then you start advocating for yourself and finding answers. But it's just the symptom management and the symptom expectations, I think, were the biggest thing that was so challenging.
Yeah. Did you find that you really had to be out there advocating and figuring out, like, once you got the diagnosis from there, were you the case manager just trying to figure out, can you tell me again and remind those listening, your loved one stayed at home? Who was providing the
Yeah,
care?
my dad was the primary caregiver, and myself and my siblings were obviously the secondary caregivers. So yeah, it was definitely a journey of just seeking out information. And I always laugh on, you know, you get on different Facebook pages and somebody will describe a symptom about any condition, and someone will respond, oh, why don't you just call the doctor, and instead of asking this on Facebook. But you quickly learn that it's the peers that are going through the same thing you are is where you're getting the most information.
Yeah.
I mean, I was lucky to join a Alzheimer's, you know, support group. And honestly, if I didn't have that support group, I really don't know where I would have been. I mean, it was just invaluable, the information I got and the resources that I was able to learn and share with people going through the same thing that I was. So
Did you find, through your physician or the support group, or did you have to try to just, like you said, you're going on Facebook groups and things? Did anyone put any information together for you? Pamphlets, books? Here's kind of a self-study of things that might help your family? Nothing?
No. Like I said, the Alzheimer's Association was probably the only one that just really provided us with a lot of resources. But like I said earlier, I mean, I was just shocked by the actual doctors that just weren't forthcoming with a lot of information on, what to expect. Like Jennifer said, I mean, we know there's not a cure. We know there's not a magic pill, but just being able to say, this is what you might see, and it's never the same for anybody, but at least having some type of a base, or just some type of, a general like understanding that could help you manage these symptoms. So
I mentioned, Barb, in the chat that, sometimes we stumble upon, like, it feels like Christmas, a free resource. The National Institute of Aging has an Alzheimer's disease education and referral center called a DEAR. So I put this in the chat for everybody. And providers, we can make resource libraries for family members like Barb. And there are some really nice size books, 100-page books on caring for the caregiver, how to care for someone living with Alzheimer's. And Barb, what really resonates with me from what you described is they have a tip sheet on agitation and unique behaviors presentation, because you're right. You cracked it so wide open right on the first thing you said, that everybody thinks it's forgetful, it's repeating. No one talks about the personality change, the hallucinations. Can you tell me a little bit about your dad and your siblings? How did they deal with, your dad living with her day to day? Anything you might impart on that?
It's funny, as I've learned through the support groups, and now just in dealing with families that I deal with some of my clients, that the family dynamics are very interesting. I mean, you always get the one family member that's in denial and doesn't want to help, and I had one of those. My dad, God love him, was in good health himself, and was able to take on a lot, but he certainly did not take respite and did not get the breaks that he needed. I mean, as a couple years went on, we did bring somebody that would give him a break for a couple hours. But I think that's the hardest thing with caregivers, is they just, it ends up killing them or leading them to horrible health issues because of the stress and the lack of sleep and, that kind of thing. So I think I find that now with elderly people that I help, it's that, they're trying to do everything, or so many people, oh, I don't need help, I don't need that and they just, and I think trying to get answers, I mean, so yeah, it is just so valuable to the main caregiver itself. But
what I appreciate is that you've taken your experience, and I feel like you've kind of put it into action to help families after what you've gone through with your involvement through your parish, and possibly getting them to start support groups and resources. And I wonder if your family did you have any support from your church community or your community neighbors, or any groups that your parents were involved with?
Definitely, definitely neighbors. I mean, we had a pretty tight group of, and then, my own relatives, like my mom's sisters. But I mean, I find that the average friend, neighbor, they're uneducated and they don't know how to handle it. I had a dear neighbor that did the most, I think, amazing thing. I mean, she went and studied everything there was to know about Alzheimer's and how to communicate with somebody. I mean, she did that just so she could communicate with my mom and know what to expect, which was just such a selfless act that she did. But I mean, the average person, just doesn't even know. And so they kind of ignore it, you know, and then it becomes kind of like an embarrassing situation out when you're out on the street because, you know, they're kind of like, oh, you know, they're like knowing something's wrong with my mom, but don't know how to respond. I mean, and that's for any really major terminal illness. I think people's lack of understanding shuts them down. And, you know, as the person with the disease or the family member, you take it as something rude, but really they're just shutting down because they just don't know what to say or how to act.
Be
So,
fear. It could be fear. I think,
yeah.
and you noted this was about 10 years ago that your family was going through this. Is that right?
Yep. Well,
Yeah.
yeah, I mean, probably 15 or 16 when we started the journey, and then
Wow.
it's been
Okay.
11 since she passed.
Well, I'm so sorry, but it is neat to hear how you've taken her legacy and you're helping other seniors and improving lives. I think you probably know this, and maybe they had them even back then, but if not, I'm sure most of people on the webinar today, through the Alzheimer's Association and different organizations, you can get a little card you can take out when you're in the community. You know, you can pass it to the waitress, like I'm with someone with Alzheimer's, or
Exactly.
yeah, right. Just that little nudge on the side, you know, please have compassion.
Yeah.
What would you say about navigating the stress, you know, for trying to live your own life and basically becoming a case manager of your mom's care? Did you find, you know, anything that kind of helped you to keep balanced, or any tips for other family members you might think could be helpful? And you can be honest, because the answer might be no.
Well, I mean, managing the stress was, I mean, I think the worst part about it. I think just keep stressing to people to take breaks and get help. And I mean, I'm just shocked on how many, you know, elderly people, you know, oh, I don't need help, or I don't want to bring in somebody into the house, and they think they can do it all, and you just can't. You can't do it
Yeah.
all, and especially if you're the primary caregiver. I mean, I see that, you know, I saw the people coming into these support groups that were the primary caregiver, and you just look at them and they're just physically, you know, drained. So that would be the biggest thing, is just you got to take time for yourself, and it's hard to do, but if you don't do it, you just, I mean, I say this with love and respect. I mean, my mom's journey went fast and
Yeah.
really fast. But for these people that it stretches on for 10, 15 years, 18 years, I mean, it just physically kills you and wears you
Yeah.
down. And especially if, you know, the primary caregiver is you know, an elderly person themselves. So, yeah.
I felt that last year myself. I was supporting my mom, who Jen, you'll have to correct me because I don't know the sclerosis, or any nurses on the call. I believe, is it hardening of the arteries? Does that sound right? Okay. So I thought I was like one up on the system, being in the field, that I was going to get my mom on hospice, and she would be like one of those who would just get some extra support as she had to go to skilled, and then we'd like graduate off. And I was all cocky about it, that she was going to live forever. Because the nurse called me from the building and said, we had to let you know your mom's going to need to go out for a psych eval. She's been yelling, help me, help me, help me down the hall. And she's getting all the other people fired up. And I was like, oh, not my mother. She could pass the mini mental with the flying colors. She knew who the president was. But again, that vascular change and kind of repetitive and compulsive and fixation, I was just so shocked that that was actually the truth for her. But Barb, I ate my way through the stress. I put on 75 pounds last year, and having my child simultaneously was in a residential care setting for a year. So I didn't follow my own advice. So I was a complete, what is that called? A fake? You know, I'm out here teaching all these things and I was just falling apart. I did end up getting in a specialized program for grief. I'm so grateful for the hospice world. I completely used their bereavement support. And in addition, I started to use my faith and quality over quantity. And Barb, you had the gift, your mom stayed in your home, but I was trying to get out there 4 or 5 days a week to just check it off my list. But all I was doing was frazzling her and frazzling me. So any of you who can also share with family, sometimes we just appreciate how dedicated you are, but maybe once or twice a week when I was caffeinated with Starbucks after church on a Sunday, and I had 3 or 4 hours to give without feeling like I just, felt so stressed. And I feel like people with dementia can sense that. They can sense when we're stressed,
I agree.
Barb, there's glimmers of joy. And I feel like your mom had a tea party, and I bet that was enjoyable. Over the journey, do you have some glimmers that brought joy and purpose, or moments of hope, even though you're told it's a terminal disease and it's so dark? Was there some moments of light for your family through this?
Yeah, so I saw in the chat you put the one book, Creating
Yeah.
Moments of Joy. That was one of my favorite books as well. I think somebody with Alzheimer's, sometimes they recognize the very basic things that we take for granted or don't realize what we're doing. And I think I think those were special times where they would just look at you in your eyes, and that they don't know who you are, but they see you, they see the inside of you. They say, "Oh my gosh, you have such a beautiful soul." And you're like, "What?" What the? But it's just like it's somewhere in there, they're still there. And it's a hard thing to realize, but because they're so not there in every other aspect. But I believe that there's still things there that are still them. So I think those were the moments of joy for sure.
Yeah, I'm glad you enjoyed that book too. I like it. It was nice and light. You didn't have to think too much
Yeah.
about it. I was also going to give a practical thought. No kickbacks. Got to be real careful for being Chicago girls, that I have no relationship with any of these. The skylight. Have you heard the skylight before, Barb? Or
No.
Jen? Have you heard of it, Jen? The skylight?
I've not heard of it, no.
It's to me a low cost intervention that I think could be interesting for families. It's basically like a interactive picture frame. It's almost like a tablet.
Okay.
And, for my extended family and my siblings, I was the local yokel. The brothers in California sending me a check every now and then. We're dealing with most of the day to day, but he sent the skylight, and I thought, oh boy, of course, now I'm going to have to set it up. But in the end, it turned out to be such a gift because all of us had an app where we could send pictures. I would send letters in big bold font. You could send little video vignettes. It was like $70, but just a low cost way for families. So for any providers, if you're doing care plans and maybe they have extended family all over the country, that's a neat way to kind of keep people involved, and brought a lot of joy to my mom. And in a way, now it's a time capsule for me. I play it still.
Cool.
So
Yeah.
Barb, what do you think? You and Jen and I had a little talk yesterday, like it feels so unbelievably amazing and a little too good to be true. If you would have had a resource like this, you had gone to the neurology or the family doc, and they immediately were like, we want to enroll you in this program and do this assessment and figure out what you need. How would that have felt back then to have had this?
Amazing. I mean, truly amazing. Because I think that's the hardest thing, is just, and especially at the beginning when you really don't even understand, is this Alzheimer's? Is it just, you kind of question the diagnosis. You're in a little bit of denial. And so it's like, you kind of don't even know, do I start with my primary? Do I go right to a neurologist? You're just kind of confused at the steps to take. So having like one number that you can call that would even just navigate what kind of doctors I'm supposed to be seeing. Some of us maybe didn't even know who a neurologist does or is capable of. So yeah, when I first saw it, I was definitely like in shock and awe, because like, wow, something like this could actually happen. So yeah, I think it would have been amazing. I think for many of us, like my family lived in a small town, outside of Cleveland. So, we didn't have a lot of resources. You would travel to Cleveland or Columbus, and So, I mean, that makes it even harder. So, you know, like I said, having somebody that could, you know, find the resources for you would have been, you know, amazing.
Yeah, the kind of the hub to all the spokes.
Yeah.
And then everyone's speaking to each other. That
For
was one
sure.
thing I noticed with my mom is she was a frequent flyer, if any of you know what that is, when they were in the ER regularly, to the point we were on first name basis with people. And, you know, again, it's like they would just, different places kept adding meds and nobody was talking to each other, and could make for quite an adventure. So I'm a little bit of a hippy dippy. We're wrapping up. I'm going to close with, okay, I'm really not this vain, but I had a pillow made of my brother and I. And this I put in the chat. It's called Dream a Pillow. And so it was an intervention that gave my mom comfort. She didn't have to hold a doll or a stuffed animal. You could have a husband made into a body pillow. You could have a favorite pet made
That's
into
amazing.
But anyway, I just thought this was kind of fun. I keep it next to my desk as a memory. My mom did pass on last May. But Barb, the feedback in the chat has been resounding,
Yes,
just
yeah.
so positive that you gave your heart and your time to share your journey. So
Yeah.
I really
Happy
appreciate it.
to.
Yeah.
Thank you.
And I just wanted to mirror too, real quick before we get to questions, is, you know, I conduct neuropsych evaluations as part of the Institute's clinical efforts. And, you know, I do give a plethora of recommendations with all of these key partners, but I think where the challenge is getting all of these partners to talk to each other, and, you know, the family member having to navigate it all or rely on somebody else to do it for them sometimes is challenging. So for this guide model to bring it all together, you know, it warms my heart, because I've been preaching, you know, for a long time that all of these people need to be at the table, but it's how do you get it where they're talking to each other? So yeah, I can't say enough. Thank you, Barb. Thank you, Rachelle. But Charles, do we have any questions for us here in the chat box?
Yeah, we have one, but we need to answer it in less than a minute if possible.
All right.
We waited a few, but one of them is, do private pay adult day qualify for this?
No, only because it is coming from that beneficiary who is covered by Medicare. So if Medicare dollars are not covering for the service, then no, it would not, unfortunately.
Well, thank you so much, the three of you, for such an amazing, very interactive session. Rachelle and Jennifer, every time you come, it's with additional knowledge. I'm just so excited to call you colleagues and friends, and I'm sure that all of us have learned something significant. Bob, I do want to pause and also thank you for taking the time to join us. Thank you for sharing such a personal experience. And a couple of words resounded when you said them, which is that, you know, the person is there. And thank you so much for sharing your experience like that.
No problem.
As a quick final announcement, we wanted to share the fact that our upcoming education on September 3rd is going to be one of our largest events of the year, and we're very, very excited. I'm plugging the calendar, the invitation link where you can register to it, but it's a 3-hour event. It's all on this idea that we kind of touched on a little bit, but this idea of dementia inclusion. And we talked about the DEAR program. I think, Rachelle, you were the one listing it. It's actually led by Dr. Jennifer Carson. And the whole day is all about dementia inclusion. So essentially, you know, this question that we're very passionate about, which is, if I have dementia, why would you treat me differently? And so how do we include everyone, including people living with dementia, in the models we're building? And so we're very excited for this session. With that, I want to give a final thank you and goodbye to Rachelle, Jen, and Bob. Thank you so much for this session. Everyone, thank you so much for joining, and excited for this new model.
Thank you so much. Take care, everybody.
Thanks.